That's right, Glee. So we've seen around a dozen of these clinics really just open across the state today. We've seen one attached to the hospital here at the Royal Brisbane and Women's Hospital. And these openings of these clinics come as the nation scrambles to contain this coronavirus outbreak. Now, these fever clinics are attached to hospitals, so they are state government funded. But of course, we have just had the federal government's announcement of a $2.4 billion health package, and that will see more of these types of clinics open. They'll be separate from hospitals. They'll be attached to GPs and doctors, and they will be federally funded, about 100 of them across the country over coming days and weeks. Now, patients who attend these clinics will be taken to a designated area. They'll be tested, and if need be, they will be quarantined. Doctors say there is a set criteria, though, before you head in.
The current criteria for testing is that you have had any kind of overseas travel now within the last 14 days of symptom onset, that you're, the other criteria is that if you're a healthcare worker, we will test anyone who's had a fever and respiratory symptoms. Other criteria include contact with a known case of coronavirus, which of course is very low at the moment. And we are also testing those patients who are critically unwell with certain types of pneumonia as well.
Now, this comes just as two more cases of the virus have been confirmed in Queensland this afternoon. They are a 32-year-old woman and a 31-year-old man. They're currently in isolation on the Gold Coast, and Queensland health authorities say they're working to contact people who may have come into contact with this couple.
Two most recent cases are two people who live down at the Gold Coast and have been admitted and isolated there. So the first case came back from the United States, and a person they live with has become infected as well. So those are those two cases. So at the moment we've started the contact tracing process, and that will involve some flights. So we'll be sorting out with the Commonwealth and the manifests for those flights so we can contact the people who need to be contacted there.
So there is a third case authorities are working to trace, and that's a 22-year-old student from the University of Queensland. He'd been travelling in Europe and then returned to Australia. Queensland Health have just released some advice that he spent most or parts of the weekend, Friday, Saturday, Sunday and Monday night at Friday's nightclub in Brisbane. They're asking anyone who was at the club during that time to contact 13 Health. At the moment, his university, the University of Queensland, will be staying open. The Vice-Chancellor says that he's just advising students to take those hygienic precautions. A university, though, that has chosen to shut down is Southern Cross University. It's closed two of its campuses, one in northern New South Wales and one on the Gold Coast, after a visiting staff member from the Philippines tested positive for COVID-19.